A very good evening all. I'm Aditi Lamba with the Wednesday night edition of South Asian News. Welcome to Vision of Asia, Voice of Our Community. We are coming to you from our studio in New York City. Here is what's happening tonight in the coronavirus pandemic. The world is at 23.9 million cases of COVID-19 with at least 820,000 deaths. In the United States, more than 5.8 million cases of coronavirus have been reported with nearly 180,000 deaths. The cases in the United States are on a decline. However, experts are saying that there are now rolling hotspots where parts of the nation are being impacted by outbreaks and spread, while others are trending down. States such as Florida, Texas, and Arizona, the Sun Belt states, are finally starting to see their numbers go down, just to see the cases now surge in the parts of the Midwest. The Midwest so far had been spared from the intensity of this pandemic, but now sees numbers headed in the opposite direction. Deaths remain alarmingly high, still at 1,000 deaths a day from the virus. There is a growing awareness seen through the nation on how the virus spreads, making it more necessary now to follow social distancing guidelines along with hand washing and, most importantly, masking up, especially in the states that are surging with cases. This is also putting the reopening of schools and colleges in a very difficult situation where schools are now turning into hotspots as well of COVID-19, with students returning back for the fall semester. Just looking at some statistics here, University of Alabama has reported more than 500 cases of COVID-19 within a week of starting classes. At Ohio State University, over 200 students were suspended for violating social distancing regulations. The University of North Carolina and University of Notre Dame both have now halted in-person classes within days of starting the school year. If you are an educator or a student going back to in-person school, please write to us with your experience and opinions on events at itvgold.com. And at this time, we would like to take a moment and send our condolences for all impacted by the Wisconsin incident of police shooting, which has now left Jacob Blake, an African-American, paralyzed after being shot multiple times. The incident, which is captured on video, has sparked nationwide protests yet again over racism and use of force against minorities by law enforcement officers, reigniting the movement we all saw after the death of George Floyd. A very sad reminder of systemic racism. We again send our prayer for Jacob Blake and his family. And now there is a hurricane coming in, Hurricane Laura, which is barreling towards the Texas and Louisiana coast. Officially, they are taking coronavirus safety precautions to account as well, with enough PPE and disinfectants available. Hurricane Laura has strengthened into Category 4 storm. Here's hoping the best for the residents of both coasts. With that, it's now time to start the South Asian News segment, covering much tonight on India-Israel bilateral relationships for advancement in the coronavirus pandemic. Here are the headlines. ITV Gold exclusive on India-Israel cooperation in response to COVID-19 webinar, New York. It's time for a really short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I'm Aditi Lama, and this is Vision of Asia, Wednesday night episode of South Asian News. We are talking today about the coronavirus impact measures and the ongoing advancement and awareness about the spread of the novel virus. India and Israel researchers in India are currently working on a rapid COVID-19 testing technology and virus research to help address urgent needs of both nations grappling with the virus. On that, recently a webinar was held on India-Israel cooperation in response to COVID-19, featuring Israeli and Indian diplomats and medical professionals from both the countries, highlighting the unique and strong bilateral relationship between India and Israel and its citizens. These bilateral relationships have definitely deepened, impacting human lives at the basic level with now its shared COVID-19 management protocols. Israel has gone out of its way to approve the export and transfer of ventilators to India for COVID-19 cases, while India has also helped with Israel's severe global shortage of medicine and other essential diagnostic equipment. Here is a segment of the webinar detailing much on this bilateral relationship in COVID-19 research, featuring Consul General of India in New York, along with the Acting Consul General of Israel in New York and the Ambassador of Israel in India, Ambassador Malka. Here is the story.
I think that this event is a celebration of friendship between three great democracies. The world's greatest democracy, the United States of America, and India, the world's largest democracy. And we have a new challenger today, Israel, with already 3 election rounds in the last less than 2 years, and we're already speaking about the 4th one. So I think that at least we can challenge we can join you in the leadership for being a vivid and active democracy and a leader in the democratic world. But seriously, the special relationship between the 3 countries and nations are based on deep shared values of freedom and democracy, with a special role that we have, each country and each nation in history, that goes beyond any national or strategic interest. But there is an additional component here, a significant contributor, especially to our bilateral relations between Israel and India, which is the long-lasting relationship between the American Jewish community and the Indian American community. The brotherhood between these communities, based on, again, shared values of excellence and education. We have a lot of doctors here, and I can speak about especially the role of the Jewish mother. I'm sure that the doctors could share and say that maybe there is. I'm sure that there could be the same could go also to the Indian community, I'm sure, and of course the value of pluralism, which these communities played an important role, not only in the establishment, but also the development of the Israeli-Indian alliance since 1992. I've been here for 2 years, and I can tell you that the relationship between the communities and the consulates are a very solid basis for these bilateral relations, at least here in New York. And I also want to mention, again, the role of organizations like the American Jewish Committee, and of course, it's the AJC's CEO, David Harris, in actually contributing, strengthening these bonds. The story that we'll share here with you today is, in essence, is what Israel is all about. And it's also, in essence, what India is all about.
There are 4 areas in which, and I'm sure Ambassador MALKA would talk more about it, but there are 4 key areas in which we've gotten together. One, of course, is trying to give a helping hand to each other in the area of PPE kits. We supplied PPE kits to Israel when there was a need earlier during the year. And Israel, we were happy to receive ventilators from Israel for the state of Tamil Nadu when we needed them. The other, of course, important area, which is the topic of discussion today, is the area of diagnosis. This new testing capacity that is coming out of Israel has huge potential, to test COVID results within less than a minute, 30 seconds, as the case may be. We had a team which recently visited India. They've taken a lot of samples. It is an ongoing effort, but we are confident that with all the great minds that are there and with the commitment that we have for this relationship, for this friendship, we'll do better for ourselves and for the world at large. The other area, of course, where we are pooling our resources and our minds is how to develop new tools for forecasting a pandemic, or looking at or forewarning ourselves about the second wave of COVID-19. There, of course, new age technologies such as artificial intelligence are being employed, and we think there is a real possibility that we can do something good for ourselves. And of course, the 4th area is vaccine development. India today produces 60% of the vaccine of the world. There are a lot of efforts, global efforts ongoing to produce a vaccine for COVID-19. There are several therapeutic attempts also being made. Whatever happens, when you need the scale, India is there to support. We have a large manufacturing capacity, and when it comes to scaling up, I think the Indian backbone of the pharmaceutical industry, of the vaccine development industry, can come forward and support global efforts. So all in all, it's a happy story. It's a very innovative story. And I must tell you, when we were in India, Prime Minister Netanyahu had come on a state visit, and during his meeting with the president, we had served him Indian tea infused with olives grown in Rajasthan with the help of Israeli cooperation. It was very well appreciated. It had a different aroma, the aroma of Israel and India together, and it was very exciting, very innovative. You know, this particular seminar and the effort that we are in right now, can 30 seconds change the world through a new testing capacity, has or will have and has the same excitement, the same innovation. I wish the effort, and to all our friends who have joined here, the very best, and I look forward to the discussion.
Our scientists that has been a long time under mutual trust and mutual respect decided to focus on rapid tests for COVID-19 because we realized that it will take time until we find a vaccine and until we'll manage to immune all the population. And until then, we need to find ways to enable the economy to function and to balance between, from one hand, the effort to avoid the infection as much as we can, but from the other hand, allow the economy to go on. And rapid tests that will give us results within a few seconds, can be a game changer. So we tried many technologies, tens of them. And what we wanted to see is technologies that we can collaborate for sensitivity, technologies that will be sensitive enough to distinguish and find, so to speak, fingerprints of COVID-19, even in mild cases from one end, but will be specific enough. And this is a collaboration for collaborated for a specificity to be able to distinguish and identify the COVID-19 and distinguish it from other coronaviruses or any other viruses. So eventually we find 4 technologies that under laboratory testing were very promising. So we tested all these technologies, and now all the samples are being analyzed. We are amidst this process, and within few weeks, we will be able to know if one or maybe more of these technologies will give us the results that we are looking for.
It's time for a short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. This is Vision of Asia, the South Asian News segment, and I am Aditi Lamba. We continue now to present more highlights from the recent webinar on India-Israel cooperation in response to COVID-19, featuring Israeli and Indian diplomats and medical professionals from both the countries. Many discussed perspectives on the science behind efforts being done by both nations to advance rapid testing for COVID-19, reflecting upon the impact it may have on the current state of the pandemic. The event was presented by the AGC New Jersey in partnership with the Consulate General of Israel, the Consulate General of India, AGC's Asia Pacific Institute, the New Jersey Hindu Jewish Coalition, New Jersey Israel Commission, the American Association of Physicians of Indian Origin AAPI, and ITV Gold PARIKH Worldwide Media. Moderating the conversation was our very own chairman of ITV Gold PARIKH Worldwide Media, Padma Shri, Dr. SUDHIR PARIKH. Here is what he had to say about the progress of Indo-Israel relationships and the impact of science in curbing the spread of the coronavirus.
The Indian-American community has been a passionate advocate of close ties between India and Israel, India and USA and Israel. Since the 60s, when many of us started coming to USA, we used to request every visiting Indian Prime Minister and foreign ministers to upgrade the relationship with the Israel, which will benefit India tremendously, especially in the area of health, agriculture. Through those years, the one congressman from the India caucus was late Jewish Congressman Steve Solas, our good friend, who used to join us for meeting with the Indian prime ministers and Indian foreign ministers who were visiting New York City. And agriculture, defense, and health cooperation have become the three pillars of the close ties between India and Israel. My home state of Gujarat was among the first state government who sent a delegation to Israel to learn Israel's ability to make desert into the green land through water management and conservation techniques. We in the Indian American community, medical community, would now like to help regular exchange of the expert in the health sector between India, Israel, and command both the Prime Minister, their scientific advisors, ambassadors, Ron Malka and Mr. Singla, of making this happen with the large Israel delegation setting up a 2 weeks COVID testing camp in Delhi. A few on this call might remember that in the aftermath of the massive Kutch earthquake in Gujarat, in my home state in 2001, myself and Nissim, we both had a privilege and honor to be a delegate in the President Bill Clinton's delegation to India. And Israel, even the smallest country of the world, had the largest mission of 300 doctors, nurses who stayed in the Kutch in the massive field hospital. They set up for all the months. And Nissim Rubin, who served there, one of the main local coordinator, described the mission to us, and where our Israeli friends brought every equipment from the Israel and request a local authority for regular supply of the diesel. Many surgeries were performed in that field hospital. Few babies were born during that time. And one of the babies' name, we kept it as a Israela. Is a secretary of Global Association of the Physicians of the Indian Origin, which represents 1.2 million Indian physicians outside India. Both myself and American Association of the Physicians of the Indian Origin, President Dr. SUDHAKAR, advocate with our US government to foster the closer cooperation in the health and disaster management sectors between the US, India, and Israel. Before I invite our panelists, let me say that briefly that I'm our private practice in New York City. We are one of the investigators in the vaccine development, which is Moderna vaccine, which is in the third phase of the trial. And there are other vaccines from the AstraZeneca, Pfizer, as well as from the Johnson & Johnson. They all are in the third phase of the trial, and hopefully we'll get the vaccine before the end of the year.
It's my distinct honor to join today's panel discussion. Ambassador Dr. Ron Malka, Ambassador RANDHIR JAISWAL, Acting Consul General Israel NITZAN, and Mr. Nissim Rubin. On behalf of American Association of Indian Origin, representing interest of more than 100,000 doctors, and we're pleased to co-sponsor this important event with the Council General of Israel, the Council General of India, and the American Jewish Committee Asian Pacific Institute, the New Jersey Israel Commission, and the New Jersey Hindu Jewish Coalition. As you know, the religious ties between India and Israel stretch back into antiquity. When the Jewish people faced persecution, they could always count on the people and government of India to enable their personal religious freedom. India's rich religious history, peaceful coexistence, has been strengthened by many centuries of partnership between Jewish and Hindu communities living side by side in India. In recent years, we have seen expanded tourism, defense cooperation, and healthcare research grow between India and Israel. Health cooperation, especially in light of current global pandemic, is critical not just for the people of Israel and India, but for the entire international community. Israel has donated advanced medical equipment to India, while India has supplied Israel with medicine and personal protective equipment. Joint efforts between both allies are leading to success in developing rapid coronavirus testing along with therapeutics. Developing rapid COVID tests is one of the keys to successful unlocking the Indian and Israeli economies while following the best practices in managing public health. We can quickly find out who is positive, conduct contract tracing, and provide them with the most effective therapeutics to successfully treat patients across Israel and India. Together, we can save lives while our scientists develop a vaccine, which India has already promised to provide countries in need around the world. In this time of crisis, India and Israel health cooperation will play a critical role that will ultimately benefit millions of people across both nations and around the world. It is a partnership that we should be immensely proud that we are immensely proud of that. We are glad our friend Nissim Rubin invited us to speak at this important program. On behalf of AAPI, our best wishes, gratitude, support to Ambassador Ran MALKA, and looking forward to meet Sanjeev Singla, Ambassador from India to Israel, and Consul General RANDHIR JAISWAL, and Israel Consulate NITZAN, and Consulate Adva Wilczynski. And God bless US, Israel, and India.
Thank you. Thank you, Dr.
It is a matter of great cooperation between the two countries for donation of the medical equipment developed for combating, as outlined by the Honorable Minister, Ambassador Ran MALKA, in 3 or 4 fields. The testing which was developed with the 9 days trip to India and collecting 20,000 samples is called the point of care testing. And it is an antigen based testing which can identify the 6 antigens which are present in the coronavirus, coronavirus 19, virus. And these antigen can be recognized when 2 or more antigen are recognized by the rapid test. The test becomes very, very specific. And the specificity of this test is what we are looking for to be determined by the data which has been taking place. As our GAPIO secretary mentioned and our Honorable Ambassador JAISWAL mentioned, the cooperation between the two countries is not only at the medical level, which has been going on, it is also at the agricultural level, which was mentioned by Ambassador JAISWAL, and at the defense level. I think at the present time, India-Israeli relationship in the defense level is of the very significant proportion. So with all this thing going on in the pandemic, we are hoping for a greater cooperation for the benefit of not only India and Israel, but for the entire world, for the economic advantages those rapid testing would bring in. And I'll close my remarks with that, with sincere thanks to every listener for listening to this. Thank you.
And that is all for tonight's show. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.